Slides having special characters and diagnosed by low power. Those covered by stratified squamous epithelium on both sides are lip, examined by eyepiece and low power. Tongue, examined by eyepiece and low power. Eyelid, examined by eyepiece and low power. Those covered by stratified squamous epithelium on one side are papilla foliata, examined by low power. Mammary gland, resting mammary gland, examined by eyepiece and low power. Lactating mammary gland, examined by eyepiece and low power. Those having secretory acini are mixed salivary gland, examined by low power. Parotid gland, examined by low power. Pancreas, examined by low power and high power. Those having special characters of polyhedral cells are liver, with or without gallbladder, examined by eyepiece and low power. Liver pig, examined by low power. Those having special characters of secretory cells are thyroid gland, with or without parathyroid gland, examined by eyepiece and low power. Suprarenal gland, examined by naked eye and eyepiece and low power. Slides having special characters covered by stratified squamous epithelium on both sides are lip. Its outer surface is covered by skin containing hair follicles, while its internal surface is lined by mucous membrane rich in glycogen, and the corium is rich in blood vessels, lymphatics, nerves, and groups of mucous acini called labial glands. There is a central core of voluntary striated skeletal muscle fibers running in various directions. Tongue. It is covered by stratified squamous epithelium from both sides, mucous membrane. Its ventral surface is smooth, while the dorsal surface is rough due to the presence of lingual papillae. There is a central core of voluntary striated skeletal muscles running in various directions. Eyelid. It is similar to the lip, where its outer surface is covered by skin containing hairs and eyelashes, which are long stiff hairs present at the lid margin, while its internal surface is lined with mucous membrane called palpebral conjunctiva. There is a central core of striated skeletal muscle fibers, together with a plate of connective tissue called tarsus containing modified sebaceous glands called meibomian glands. Slides have special characters covered by stratified squamous epithelium on one side. Foliate papillae. Foliate papillae are parallel ridges of connective tissue covered with stratified squamous epithelium. Foliate papillae are rich in taste buds. They are separated from each other by deep grooves. They are rudimentary in man, but numerous in certain animals like rabbits. Mammary gland. Resting mammary gland. It is covered with thin skin at one side, containing hair follicles, and the stroma is very predominant, formed of areolar and adipose connective tissue. Parenchyma is formed mainly of ducts, with few acini. The ducts are lined with simple columnar epithelium. Lactating mammary gland. It is covered with thin skin at one side containing hair follicles. Stroma is scanty, formed mainly of adipose connective tissue. Parenchyma is formed mainly of secretory acini. Most of them are filled with milk, which appears red and vacuolated as a result of dissolved fat. Ducts are few. Some of them may contain milk as well. They are lined with simple columnar epithelium. Slides have special characters of secretory acini identified and diagnosed by low power. Mixed salivary gland. Mixed salivary gland is a pale section with clear lobulation, capsule and trapecule. Acini are mucous, appear large and lightly stained. Some of them show crescent of Giannuzzi. Few acini are serous, darkly stained. Duct system is well developed. Parotid gland is dark blue section with well-developed lobulation, thick connective tissue capsule, and thick trapecule. All acini are serous, dark blue in color. The duct system is very well developed. Pancreas is also a dark blue section, but it has poorly developed lobulation with thin connective tissue capsule and thin trapecule. Acini are serous, appear dark blue with central acidophilic granules. The duct system is poorly developed. Islets of Langerhans are scattered large pale areas present in the pancreas, differentiating it from the parotid gland, which is a serous gland. Slides have special characters of polyhedral cells, identified and diagnosed by low power. Liver. Human liver with gallbladder. It has poorly developed lobulation, capsule and trapecule. Liver cells or hepatocytes are large, polyhedral, acidophilic, with large pale nuclei, and they are arranged in plates radiating from the central veins. Portal areas containing branches of portal vein, hepatic artery, and bile ducts are present at the corners of classic hepatic lobules. Gallbladder has folded mucosa lined with simple columnar epithelium resting on a connective tissue corium. Musculosa consists of irregularly arranged smooth muscle fibers. Serosa covers most of the gallbladder except where it is attached to the liver, where it is replaced by adventitia. Liver pig. It has clear lobulation. Hepatocytes are seen arranged in plates radiating from the central veins. Portal canals or portal areas containing branches of portal vein, hepatic artery, and bile ducts are present at the corners of classic hepatic lobules. Slides have special characters of secretory cells identified and diagnosed by low power. Thyroid and parathyroid glands. Thyroid gland has poorly developed lobulation, thin connective tissue capsule, and incomplete septate. The parenchyma is formed of thyroid follicles separated by blood capillaries. The follicles are lined with simple cubical epithelium and enclose a homogeneous acidophilic colloid in their centers. This differentiates thyroid gland from lactating mammary gland. Lactating mammary gland is covered by thin skin, and the milk enclosed within the acini appears acidophilic and vacuolated as a result of dissolved fat. Suprarenal gland has also poorly developed lobulation, thin connective tissue capsule, and short and incomplete septi and reticular fibers. The parenchyma is divided into an outer dark cortex composed of 3 zones: zona glomerulosa, zona fasciculata, and zona reticularis, and an inner palar medulla formed of branching and anastomosing cores of cells separated by fine blood capillaries.